send it on over to my colleague, Ian Lee. He is in Nebraska, and he has been tracking those American passengers who just landed there this morning. Ian.
Good morning. Those 17 Americans evacuated from the Hantavirus hit cruise ship are now back in the United States. Their convoy arriving at the hospital just an hour ago, where they're being monitored at the National Quarantine Unit here in Nebraska, the only federally funded unit of its kind in the U.S. An aircraft carrying the passengers touched down overnight in Omaha. And as Ramey just reported, one passenger has tested positive and another is showing symptoms. Officials said both were moved into the Nebraska biocontainment unit built to handle highly infectious diseases. The World Health Organization says infection can spread through close, prolonged contact and recommends 42 days of monitoring to cover the virus's incubation period. The University of Nebraska Medical Center has long prepared for cases like this. The facility gained national attention during the 2014 Ebola outbreak when it treated infected patients brought back to the United States. Kelly?
All right, Ian, thank you so much. For more on what you need to know, let's bring in our chief medical correspondent, Dr. Jon LaPook. Good morning, doctor. Okay, so sort of paint a picture for us. We've got those passengers who are now headed to the facility in Nebraska. What are we expecting? What's happening right now?
What are they trying to prevent? Why the big deal? What they're worried about is you have an incubation period of up to 6 weeks. So what if the virus is incubating, right? No symptoms, you have no idea that you have it, and you just go home. Suddenly, you become symptomatic. And we know from Dr. Palacios, who I spoke to this morning, did the studies, that you're most infectious and contagious right when you become symptomatic, right? When public health works, nothing bad happens. The bad thing that would have happened here is the person who tested positive this morning, this is really important news, that person, if they just went home, they would have been walking around, and then suddenly, you have a little, aching and maybe a little fever, you don't know, you don't realize you're sick, and then suddenly you become symptomatic and you spread it. What they've done here is, because of the abundance of caution and the public health measures, as they were flying over here, the people who they were worried about were in biocontainment pods, special pods, so that they wouldn't infect the other people on the plane. They got here. The person who tested positive is now in a special biocontainment unit where they can get specialized care if needed. Everybody else is being quarantined, is being monitored closely.
But Dr. LaPook, somebody brought that virus onto the boat, which means they got it from somewhere else and took it there. And I think Americans are concerned that this could be another coronavirus, another COVID.
Right.
So can you explain why that is not the case and why public health officials are not concerned that this is going to be the next big pandemic?
Right, and I understand the problem. The problem is we all have PTSD, a lot of us do, me included, for the pandemic, right?
Do you think this could be a pandemic?
No, absolutely. I'm going to just say it right now. Okay, I'll go on.
That's great news.
Yeah.
This is not going to be a pandemic. And And it's brushing up against the advice of the WHO that's giving you reassurance. But what's giving me reassurance is not the reassurance of somebody saying, don't worry. It's the science here. And we know that COVID can float across the room. It can be spread from person to person easily. This, yes, can be spread from person to person. But over short distances, it's basically adapted to infect rat to rat, not human to human.
Okay, so can I ask you a question that's been driving me crazy? So as recent as last year, some data has shown the rattiest cities. You have...
oh, boy, watch what you're saying there.
Los Angeles,
I know he's going here.
Chicago, and New York.
Yeah.
Meaning the cities with a lot of rats.
Yes, not the rattiest cities. But how could it be that you can have tons of rats in the New York area or in Los Angeles or in Chicago or any major city, and then we get the Hantavirus on a cruise boat where people are doing water sports?
Right.
I'm really curious about that. And I don't know if you know the answer.
No. Well, so I knew nothing about Hantavirus, and now I know a ton because I've been reading. Basically, in the United States, and it's not the species that can go from person to person. It's in the Four Corners area, where it's very dry. South America, very dry.
Okay.
And what happens is the feces or the saliva or the urine gets, dries up, and the particulate matter goes up into the air, and then you can inhale it, and you can get it that way. Somebody got infected by a rat, probably, came onto the boat, and then from that point, how many people became ill because they also got infected by rats or because it was spread from person to person?
Okay.